Well, you know, the past week's news reminds us all that the pandemic is far, far from over. Case counts are up in many states and around the world. We are losing more than 700 fellow citizens a day. The disease is very much still in the House and now in the White House. Here to help us understand where we are and where we may be headed is Dr. Ashish K. He is the Dean of the Brown University School of Public Health. Dr. K, thank you very much for being with us. It's very nice to see you again. Let me begin by asking you a sort of simple but very complicated question. Where are we in terms of fighting this pandemic? And how long do business leaders like those who are participating here today need to plan for the extraordinary measures that many businesses have had to take? Is it a 6-month plan? Is it a year? Is it longer?
Yeah, thank you for having me on. We're about 9 months into this pandemic, and I expect that we will continue to see substantial disruptions for probably another 9 or 12 months. And that's if everything goes well. Life will probably never quite get back to what it was in 2019, but we can get most of the way back, I think, starting by next summer into the fall. The vaccine that we're all counting on is going to help a lot. It will not bring everything to an end immediately, but it will certainly make things better and let us get much of the way back to what will be a new normal.
So plan, I'm hearing you say basically, if this were a golf match, we're somewhere around the 8th or the 9th hole with another 9, with the back 9 to play. Am I understanding you correctly?
That's exactly right. That's a great analogy. I've been thinking baseball terms, and I've been saying we're kind of about in the 5th inning, but same idea. Once the game is over, once we get to the 18th hole, to use yours, Tyler, life will not go back to 2019 normal. There will be a new normal, and we have to plan for that as well. But it will be clearly better than it is right now.
Businesses, I'm thinking of smaller businesses or even larger businesses, have had to adapt, both in terms of their interior architecture, how many people they'll have on site at any one time, or I think most poignantly of the small retail or food service business where the signs on the door say 2 customers at a time, that's all. That is a difficult sort of throughput rate to adjust to. How can businesses execute and get ahead? I'm asking a public health person this, but you know what I'm driving at here. How can they expect to get back in terms of revenue and profit to anything like what they had if we have to maintain those kinds of limits on customers in stores?
Yeah. So there are a couple of thoughts on this. I mean, first of all, I'm obviously not a business expert, but my sense is for especially small businesses, even under normal circumstances, hard to make business work and hard to make ends meet. So it is an extraordinary time. I think the creative ones are going to figure out how to do more stuff. If you think about restaurants, how to do more takeout and how to do more delivery. Other types of retail stores, if you have people wearing masks, you can let a lot more people in, and you've got to work on ventilation and you've got to work on other things that make it safe to be indoors. The air experts tell me, and I believe this, that you can make almost any indoor space as safe as outdoor space. It just takes work and investments and kind of reconfiguring. So I think that's going to have to happen. Restaurants and bars are going to have more of a challenge because you can't have people without masks in them. By definition, if you're at a restaurant, you have to take off your mask. I think they're going to have to think more creatively about how many people can they get in, what can they do. It's going to be a very difficult 6-12 months ahead. I do think some people will figure it out and come up with new business models for how to deliver these services.
Very interesting. Before I get to sort of the mental health question, I want to ask you where you think we are in terms of a vaccine, not just whether a vaccine can be released into sort of experimental use or first responder use, whether it's before the election day or after it, but how long might it be, in your view, before it will be widely available? And what do you think the uptake rate will be among the general population?
These are fabulous questions. So very quickly, I do think we'll have an emergency use authorization of a vaccine some point this fall. We should be following the FDA guidance on what data we want to see to make sure it's safe and effective. You're going to see first responders starting to get them. And I wouldn't be surprised if some of them, doctors, nurses, firemen and women, those folks getting it early, late this year or early next year. In terms of the broad American population, I'm expecting April, May as a time period where large numbers of people start getting vaccinated. And, whether Americans are willing to take the vaccine will depend a lot on what the data says and what the process is. So far, the vaccine development process has been done with incredible scientific integrity. There has been recently political pressure. I think I prefer that not be there. If we can let science drive this, my sense is a vast majority of Americans will end up getting vaccinated.
All right, let's move on to the mental health issues here that have gotten some discussion, but maybe not as much as they deserve. The isolation that has affected many of us has really hurt people in many ways that we can calculate today and some that will probably show up over time. What can businesses do to be ready for what I would suspect would be rising mental health issues both in the workplace and at home? What do they need to be on the lookout for?
Yeah, this is a great question. We are social animals, as we say, and it's been very difficult 6 months for a lot of people. And unfortunately, because we're not done, it's going to be another difficult 6 to 9 months ahead. I think we have to really lean into this mental health issue. And there are several things that need to be done. I mean, first of all, we do need to make sure people are covered for for significant mental health issues. People have depression, anxiety. Those require professional help. And a lot of health insurance plans don't do adequate job of covering those. So for the more severe cases, I think that's what we need. For everybody who's suffering through some level of mental distress going through this, I think finding new ways of trying to get people connected to each other, social interactions, even before a vaccine is available. I think companies have to think about how do I create opportunities for people, maybe people to get together in small groups, in person, maybe finding more ways of engaging people to interact with each other online. None of it is a great substitute for what we want to be able to do. But I think thinking proactively about this is going to be very important.
Are you? I don't want to delve into sort of the politicization of the pandemic, but are you confident and comfortable that science and medicine are leading the way in terms of the development of therapeutics, in terms of the development of a vaccine, or that the waters have been overly muddied by political pressure?
I don't think the waters have been overly muddied. Look, first of all, like 10 months ago, none of us had even heard of this virus. And so what we have today in terms of therapies, whether it's the experimental cocktail from Regeneron that the president got, the 2 other therapies, the incredible progress on vaccines, the scientific community has, I think, exceeded all expectations in terms of what a phenomenal job it has done. And again, with a great level of integrity. Politicians do like to meddle. That's what they do. This has gotten more politicized than I think all of us had hoped. And at times there's been a lot of misinformation. But the scientific community has gotten us very far. And if we trust the science, I think we can get to a very good place in the upcoming months.
Dr. Jha, I think you speak for all of us in saying it's really been an amazing year in terms of the speed with which science has moved, the speed with which the medical community has moved, and the speed with which all businesses across the country have moved and pivoted and done what they had to do under really extenuating circumstances. Thank you very much for your time today, sharing your time, your insights and thoughts. We really appreciate it. Hope to see you again soon.
Thank you.